Breast cancer occurs when breast cells develop mutations and begin to divide and multiply. People may first notice a lump in the breast, discoloration, texture changes, or other symptoms. What is breast cancer? Cancer occurs when changes called mutations take place in genes that regulate cell growth. The mutations let the cells divide and multiply in an uncontrolled way. Breast cancer is cancer that develops in breast cells. Typically, the cancer forms in either the lobules or the ducts of the breast. Lobules are the glands that produce milk, and ducts are the pathways that bring the milk from the glands to the nipple. Cancer can also occur in the fatty tissue or the fibrous connective tissue within your breast. The uncontrolled cancer cells often invade other healthy breast tissue and can travel to the lymph nodes under the arms. Once the cancer enters the lymph nodes, it has access to a pathway to move to other parts of the body. Signs and symptoms of breast cancer. In its early stages, breast cancer may not cause any symptoms. In many cases, a tumor may be too small to be felt, but an abnormality can still be seen on a mammogram. If a tumor can be felt, the first sign is usually a new lump in the breast that was not there before. However, not all lumps are cancer. Each type of breast cancer can cause a variety of symptoms. Many of these symptoms are similar, but some can be different. Symptoms for the most common breast cancers include a breast lump or tissue thickening that feels different from surrounding tissue and is new. Breast pain. Red or discolored, pitted skin on the breast. Swelling in all or part of your breast. A nipple discharge other than breast milk. Bloody discharge from your nipple. Peeling, scaling, or flaking of skin on your nipple or breast. A sudden, unexplained change in the shape or size of your breast. Inverted nipple. Changes to the appearance of the skin on your breasts. A lump or swelling under your arm. If you have any of these symptoms, it doesn't necessarily mean you have breast cancer. For instance, pain in your breast or a breast lump can be caused by a benign cyst. Still, if you find a lump in your breast or have other symptoms, contact your doctor for further examination and testing. Types of breast cancer. There are several types of breast cancer, and they're broken into two main categories: invasive and non-invasive. Non-invasive breast cancer is also known as breast cancer in situ. While invasive cancer has spread from the breast ducts or glands to other parts of the breast, non-invasive cancer has not spread from the original tissue. These two categories are used to describe the most common types of breast cancer, which include ductal carcinoma in situ. Ductal carcinoma in situ, CIS, is a non-invasive condition. With CIS, the cancer cells are confined to the ducts in your breast and haven't invaded the surrounding breast tissue. Lobular carcinoma in situ. Lobular carcinoma in situ, LCIS, is cancer that grows in the milk-producing glands of your breast. Like CIS, the cancer cells haven't invaded the surrounding tissue. Invasive ductal carcinoma. Invasive ductal carcinoma, IDC, is the most common type of breast cancer. This type of breast cancer begins in your breast's milk ducts and then invades nearby tissue in the breast. Once the breast cancer has spread to the tissue outside your milk ducts, it can begin to spread to other nearby organs and tissue. Invasive lobular carcinoma. Invasive lobular carcinoma, ILC, first develops in your breast's lobules and has invaded nearby tissue. Other, less common types of breast cancer include Paget disease of the nipple. This type of breast cancer begins in the ducts of the nipple, but as it grows, it begins to affect the skin and areola of the nipple. Phyllodes tumor. This very rare type of breast cancer grows in the connective tissue of the breast. Most of these tumors are benign, but some are cancerous. Angiosarcoma. This is cancer that grows on the blood vessels or lymph vessels in the breast. This is it for part 1 of our breast cancer education. Watch out for part 2.